So just moving on then, I've been in Canada now for close to 10 years, a bit over 10 years, and I spent a lot of time in my earlier career with the Australian Institute of Occupational Hygienists. So the AOH has over 1,000 members in Australia. They're the only occupational hygiene group in Australia, and they've done some really great work. And there's the person that I want to like you to listen to, Kate Cole. She's the president-elect, and she's done a phenomenal amount of work in Australia as a leader in this area. And so I just want people to look at her presentation and just think about what they've done. So.
Well, hi everyone, my name is Kate Cole. I'm the President-elect of the Australian Institute of Occupational Hygienists, and I'm going to give you a little bit of background about what's been happening in Australia during COVID-19. So I've been asked a few questions. The first is, can I explain my position in occupational hygiene, my role as President-elect of the Australian Institute of Occupational Hygienists, which we call the AIOH, and on behalf of the AIOH, what have we done to prevent COVID infection? So I'll start off at the beginning. As the President-elect of the AIOH, I basically support our current President, Dr. Ross DiColetto, before I become the President next year. Our mission at AIOH is a healthy working environment for all, and our objectives are to promote and improve the practice of occupational hygiene and the knowledge, competence and standing of occupational hygienists. We represent our profession nationally across Australia, and we aim to increase public awareness of the field of occupational hygiene and the importance of worker health protection. The AIOH sets standards for professional competence. We prepare and publish standards relating to the training of occupational hygienists, and we make representation on matters pertaining to occupational health. The AIOH and our members have been very busy during COVID-19 in supporting businesses to keep their workers safe. We have done a lot, but I might just highlight a few of the ways in which we've helped. Probably starting at the beginning, early in 2020, we were the first to raise the alarm in Australia on the importation and use of fake face masks in industry and in healthcare. We wrote and published a purchasing guide for businesses who needed to buy P2 N95 respiratory protection and help them discern fake from real masks. Pre-COVID, if you can remember that far back, we had been in the planning phases of launching Australia's first national respirator fit testing training and accreditation program. We recognised that there was a significant need to improve the competency of fit testers against both the Australian and international ISO respirator standards for fit testing, given the vast use of respiratory protection in industry. During COVID, the ResFit team really accelerated, and we launched the program more than 6 months early so that it could support our much needed healthcare sector. We also delivered many webinars and volunteered our time and expertise on numerous state and national task forces to improve Australia's response in the protection of workers from COVID-19 infection. So the next question I'm posed is, you've had a lead role and work in an Australian national advisory capacity. Can you explain what this advisory group does and your role within this group? In October 2020, the AIOH was invited to nominate a representative to join the Australian Commission on Safety and Quality in Healthcare National Clinical Task Force. The task force was established by the Commission to advise on the amendment of the previous 2017 National Safety and Quality Health Service Preventing and Controlling Healthcare Associated Infection Standard. We'll just call it the standard. I was nominated as the AIOH rep to that task force, and I promptly commenced working to review and improve that standard. The process for review was undertaken with particular reference to transmission-based precautions, environment and other controls in relation to SARS-CoV-2. And my role basically was to provide technical expertise in the field of occupational hygiene. In addition to that standard, I also volunteered my time on the National COVID-19 Clinical Evidence Task Force Infection Prevention and Control Panel. We'll call that the IPC panel. Following Victoria's second wave, our Federal Health Minister and the Australian Medical Association had announced a series of measures to reduce the number of healthcare worker infections. And one of those measures was the formation of a partnership between our National Infection Control Expert Group, which we call ICEG, and the National COVID-19 Evidence Task Force in the form of this IPC panel. That panel aimed to include broad clinical representation and experts with a diverse range of experience from various subspecialties, and I'm pleased to say one of them was occupational hygiene. For those that have read guidance published by ICEG during 2020, it's evident that advice on workplace safety was in great need of improvement. And so my aim of joining the IPC panel was to be able to effectively communicate the principles of occupational hygiene and to enable improved protection of healthcare workers from COVID-19 infection. So my last question is, can you tell me what has transpired since this work began and what the work and subsequent guidance material means to Australia and infection control moving forward? Well, the 2021 Preventing and Controlling Infections Standard was published on the 31st of May this year. The standard has been greatly improved to focus on worker health protection. Some key examples are recognition of the complementary relationship between healthcare worker safety and patient safety, the promotion of the hierarchy of controls to design infection prevention and control systems and programs, the promotion of a precautionary approach to transmission-based precautions, which is great. So, for example, in relation to COVID-19, infection is transmitted by aerosols, as we know, and we know that evidence continues to evolve. But in this standard, a precautionary approach involves the adoption of airborne precautions in situations where there is uncertainty about the type of circumstances that may arise in the care of a patient who is confirmed or suspected to have COVID-19. This means that healthcare workers would use a P2 N95 respirator in addition to other PPE that may be required as part of standard precautions to care for this type of patient. The standard also now requires consideration of ventilation and air management system issues and emerging evidence in relation to these issues as part of a precautionary approach to responding to the risk of airborne transmission of COVID-19. In Australia, all public and private hospitals, day procedure services and public dental practices are required to be accredited to this standard. And many other healthcare facilities will also choose to be accredited in order to improve the safety and quality of their healthcare provision. For the first time, these standards now include a focus on worker health protection nationally, which is a fantastic step forward for improving health and safety in the healthcare sector. With regards to the IPC panel work, over the last 7 months, we at the panel have met regularly and we've worked to document consensus guidelines on specific infection control issues that emerged during COVID-19. I'm pleased to say that the IPC panel consensus guideline has now been published just last week, and that has resulted in ICEG also updating their guidance. And I'm proud to say that significant improvements have been made, including recognising that particles up to 100 micron in size are able to be inhaled, so no magic 5 micron cutoff anymore. It recognises that fit testing has to be undertaken before first use of P2 N95 respirators. It recognises that all healthcare workers should have access to P2 N95 respirators, and it includes the provision of a risk-based approach to inform the use of PPE. So that's a really quick snapshot of what the AIOH has been doing in Australia. I hope you're all staying safe and you're staying well. And I very much look forward to the day that borders are open once again and we can meet face to face. Have a good day, everyone.
What a fantastic leader the AIOH has and Australia has. And, you know, we really need to leverage all this great work that's being done internationally. So when you listen to this, your recording as part of the bigger recording, I just want to thank you on behalf of everyone for sharing your recording with us. So thank you, Kate.